Namaste, ma'am. The session is all yours.
Namaste, Shivani. Let me thank Shivani for giving me this opportunity for today's talk on this special International Women's Day on our international prestigious platform. I'm observing Shivani's hard efforts, sincere efforts for many years now, and she's definitely making a significant role, significant presence. And I wish her a great success and of course happiness in her endeavor of bringing yoga teachers and yoga students meet on one platform and share their experiences. Whatever I'm going to share with you is just beyond my slides which I'm going to present. Because being a practicing family physician with a modern medicine background and with almost 40 years of my practice, I'm thinking, as Shivani has said, the modern medicine from a very different angle. About 90% of my practice is related with female health. And logo of our foundation says Beyond Medicines. Because whenever we say it's a modern medicine doctor, allopathy doctor, what comes in your mind is a prescription paper and a pen. The moment we hear your complaints, we see the investigations reports, we start writing the medicines. But as the experience and as the study is going on for last almost 30 years now with the science of yoga, I'm feeling that more than diseases or rather than diseases, what I'm going to present and I'm seeing in day-to-day practice is not diseases, but the physiological variations. And that keeps me very happy and busy also in finding out what is the correlation of the physiological variations and the science of yoga. Because many troubles, many sufferings, as Mahamuni Patanjali says, are the kleshas. The kleshas are nothing but imbalance in our physiology. And merely saying imbalance is not a disease. It is just an imbalance. And how appropriately Shivani has given me this topic, balance hormones with yoga. Because nowadays, whenever a patient sits in front of doctor, at least for me, that is my experience, and I ask her, what is wrong with you? How can I help you? Then she says, doctor, I am having hormonal imbalance. So instead of telling the complaints, she's directly jumping to the conclusion that I am having hormonal imbalance. And if I ask her, what does that mean? She's totally confused, utterly confused. She doesn't know what to answer. She tries to answer that whatever hormones are in my body, doctor, are all imbalanced. That is the way her interpretation is. But she doesn't know what are these hormones and what is this imbalance we are talking about. So a very interesting topic, balance hormones with yoga. And as we can see the confusion in her face, and she doesn't know how to deal with it, whether to take medicines or not to take medicines. Let's see, where does yoga come into this picture? As we know, the meanings of yoga, or it is denoting multiple understandings. Commonly, we say yoga is a union of Atman and Paramatman, that is biological energy and cosmic energy. We also say that yoga is a concentration. Yoga is nothing but concentration and its experience. We also mention that yoga is Sanyama, that is self-control. What does Bhagavad Gita say? Bhagavad Gita says in chapter 2, shloka 48, Yogastha Kuru Karmani Sangam Tyaktva Dhananjaya Siddhya Siddhyo Samubhutva Samatvam Yoga Uchyate. So yoga is samatva. yoga means equilibrium. And here comes the word balance. So how are we going to relate Samatva, the world of yogic science, with modern medicine and hormonal imbalance? So for that, let us understand Samatva helps homeostasis. I heard for a few minutes the talk of previous lecturer, and she mentioned homeostasis. I just happened to hear a few words from her talk. And we MBBS modern medicine doctors, on our first day of physiology, we learn this word homeostasis. So our first word to learn is homeostasis. And what is this homeostasis? Homeo is similar and stasis is condition. A very important word for all yoga professionals to understand. All our organs forming various systems are working together in harmony to reach a state of homeostasis. Just a minute. So every system in the body, maybe respiratory system, cardiovascular system, renal system, nervous system, digestive system, each system is contributing towards the function of homeostasis, that is keeping similar conditions around the cell. You all know the basic unit of body is cell. Cell has to be surrounded by the ingredients which are supplying whatever is necessary to the cell, extracting whatever is unnecessary to the cell with feedback and regulations. So for example, heart is pumping blood, lungs are purifying blood, kidneys is excreting, the whole digestive system is taking out the extract from our food, and whole nervous system is controlling almost all essential activities of our body. So all systems work together. They don't fight, they don't quarrel to fulfill the aim of homeostasis. Samatva is a word from yogic science. Samatvam yoga uchyate, as we have said, is a state of equilibrium. And if our mind or chitta is at samatva level, it will help all the organs, all the systems to fulfill this aim of homeostasis. And that's why science of yoga has become so popular that, please remember, we on the path of yoga, we are helping the body and nothing else. It's a great help to body. Instead of keeping hurdles, we are doing exactly the reverse thing. We are removing all the hurdles and helping our physiology to maintain homeostasis. And that's why when we say samatva, it is not a happy state of mind or it is not a sorrowful state of mind. It is a state of equilibrium. Because to be happy all the time is not possible. Sometimes we will be happy. Sometimes we may not be happy. Sometimes the condition will be really sorrowful. But whatever may be the condition, if our mind or chitta is at equilibrium state, let us remember we are helping our physiology. And that is what is this discipline. That is what is the science talking about. And that's why yogic science, by teaching us, training us, conditioning us to be in a state of samatva, chitta at samatva level, is helping homeostasis, the basic body's aim. And who maintains this homeostasis naturally in our body? Which part of our body? Which part of nervous system? H and H, easy to remember. Homeostasis by hypothalamus. See, such a tiny, small blue part in this slide you can see is controlling homeostasis, body's ultimate aim. So hypothalamus, first of all, teaches us size doesn't matter. Whether you are small or big doesn't matter. What you do is more important. So such a small part of brain is aiming at homeostasis by controlling all the systems of our body. Hypothalamus. Now this hypothalamus, as you can see in the adjacent diagram, is the headquarter of limbic system. And what is limbic system? As the name suggests, it was at a limb. That means as an extreme part of nervous system in animal kingdom. Limbic is like upper limbs or lower limbs, something which is at the end. So limbic system is the part of brain, nervous system, which is the end part in animal kingdom. And that's why you can see this green part is deeper burrowed inside. And hypothalamus is its headquarter. Hypothalamus is boss of limbic system. As we can see the adjacent parts being thalamus, which stores and receives all the sensory inputs. Amygdala, which is a center for fear. Whenever we are afraid of something, this amygdala is stimulated. All our emotional memories are stored in hippocampus, again a part of limbic system. So please remember, hypothalamus is the headquarter of limbic system and which is a seat of emotions. All our emotions are generated in limbic system. Right from childhood, they are not only generated, they are stored also. So whenever, supposingly at the age of 40 or at the age of 50 or at my age, at the age of 64, I am remembering something what happened at the age of 18 and somebody insulted me or somebody praised me or somebody motivated me. All those emotional memories are nicely stored in this limbic system. So which is a seat of emotions. Please remember, and hypothalamus is deeply connected with it, intimately connected with this, being the headquarter. So now coming to our topic, hormonal balance. And how it is connected with female life. Hormonal balance is nothing but balance of emotions and rationality. Emotions are generated and stored at some subconscious brain. Limbic system is subconscious brain. And rationality, where does it arise? Where is this analysis? Analysis, thought process, all those versions are occurring in conscious brain. And as you can see, both images are different. For the subconscious brain, again the same image which was representing hypothalamus, which was showing limbic system, is seen here. So now we can say that limbic system represents subconscious brain. And what is around the limbic system in the form of different curvatures, which are elevations and depressions. As you can see in the adjacent figure is the cerebrum, conscious brain. So if we just break our skull, what you will see is the right-sided cerebrum. And if you cut it vertically, then deeper inside on the lateral or the inner surface is the limbic system. So limbic system is deeply buried inside. Subconscious brain is deeply buried inside. And we as human beings are gifted with such a big cauliflower-like structure called cerebrum, which is a seat of rationality. Conscious brain. So we have to remember, if at all we are aiming at hormonal balance, we have to balance our emotions and rationality. We as females, as we grow, every now and then we are made aware that we are very emotional. We cry immediately, as if the tear glands are much bigger in females than males. Within fraction of a second, we start crying, whereas males don't cry. And we are conditioned in that way. Oh, you are very sensitive. Oh, we are very sensitive. But being sensitive doesn't mean we should be weak. Because crying every now and then and crying for a long time, we are unnecessary. I don't know whether we are glamorizing the emotions or we are magnifying the emotions or we want to blackmail somebody. Let us remember, emotion should not be our weakness, but it should be our strength. Emotions are very important, but they are to be nicely balanced with rationality. We have to learn to develop the habit of finding out rational in every action, in every thought process, and whatever we are going to deal and do in life. So that way we have to have a balance between subconscious brain and conscious brain. The trick here is subconscious brain, though small in size, is very powerful. It takes over the conscious brain without conscious brain understanding it. It plays a trick. Whereas conscious brain requires training, constant repetitions, constant conditioning, constant learning, doing the same thing again and again. Then only the neuronal tracks, neuronal synapses are developed. Just having brain is not sufficient. We have to use the brain in a particular way so as to develop new connections. Then only rationality will be developed in our thought process, in our behavior, which will help us at times to find out the balance. So let us understand the role of subconscious brain in generating emotions which are helpful to us, which are making us strong and which are not going to make us weak. And finding out the cause and effect relationship in the form of rational logic. Let us learn it properly. And yogic science helps us to develop this power of rationality. Coming to our topic, hormonal balance or balance your hormones. We are again coming back to our hypothalamus, the small green part now, whatever is you are seeing in this figure. This hypothalamus is responsible for secretion of one important hormone which stimulates pituitary. Sorry for the wrong sequence on left side. Hypothalamus stimulates pituitary as it is rightly shown in the adjacent figure, which stimulates ovary, ultimately stimulating uterine endometrium. This is what is the hierarchy of hormones in our body, which is called HPO axis, hypothalamo pituitary ovarian axis, as each part secretes hormone. Hypothalamus secretes one important hormone which is called GnRH, gonadotrophic releasing hormone, because of which the phase of puberty starts. And this GnRH hormone from hypothalamus stimulates pituitary to secrete two hormones, FSH and LH, follicular stimulating hormone and luteinizing hormone, which in turn stimulate ovary to secrete two important hormones. One is estrogen and second is progesterone. which have their action on uterine endometrium in the form of proliferation and secretion. So whenever we say there is imbalance of hormones, there is imbalance of all these hormones, one after other, because it is a cascade. But where does this cascade start? The cascade or the main disturbance occurs in hypothalamus. And as we know, hypothalamus is secreting GnRH, which controls pituitary. FSH is a hormone of first half of menstrual cycle, and LH is a hormone which is next half of menstrual cycle. Our typical menstrual cycle is of 28 days. 5 days of menstruation, and then later on the cycle continues. So till 14th day, round about 14th to 15th day is the first half where hormone coming from pituitary is FSH, follicular stimulating hormone. As the name suggests, the follicles in the ovary start growing, leading to growth of one dominant follicle, ultimately releasing ovum. So once the follicle releases ovum, the empty follicle is called corpus luteum, which is under the effect of LH. So latter half of cycle is under the effect of LH, luteinizing hormone coming from pituitary. Now ovary, in addition to growth of follicles, is secreting two hormones. Again, same way. Estrogen is first half of cycle, progesterone is next half of cycle. Estrogen is a female hormone. It's a hormone of femininity. We are females because of estrogen, and we become mothers because of progesterone. So progesterone is a pregnancy hormone. Ultimately, both these hormones work on uterus, the baby bag, in the form of inner layer growth, which is called proliferation, which later on starts secreting a fluid, and hence it is called secretory phase. Now let us remember, this hormonal balance maintains the cyclic pattern of menstruation. What is most important is the cyclic pattern. Like nature has the cycle, now the month of March, the summer has started. March, April, May will be a strong summer. First or second week of June will bring rains. June, July, August, September, we say that it rains in summer, but these 4 months are for the rain. And again we feel the October heat because rain goes away, and we feel the October heat. And from November onwards, it starts the winter. November, December, January, February in India. So this is the cycle of nature, how it is nicely distributed and how it is following the rules as far as possible. Same is the natural cycle in our body, and that's what we call menstrual cycle. It has to have a cyclic pattern, and the cyclic pattern is maintained if there is balance of hormones. The moment this balance is disturbed, the cyclic pattern is disturbed. See, which is nicely showing this cycle as 5 days of menstruation. Then the blue days 6 to 12 are the follicular growth. 13, 14, 15th is the ovulation day. The ovum comes out of the ovary, enters the tube and may become baby. And from 16th to 20th day is a nice support in case pregnancy happens. So every month these events are going on in a very precise way. And the precision is really astonishing. The precision of body, the precision of physiology is really astonishing. This 16th to 20th day is the fixed period of that empty follicle called corpus luteum. And this cyclic pattern is the beauty of hormonal balance. But is this situation present in the society? When I go to clinic and supposingly I attend 15 to 20 patients, out of 20 patients, 15 patients are complaining. Either they are having late cycles or menstruation is occurring only after medications. डॉक्टर अगर दवा नहीं लिया तो महीना आता ही नहीं है. The flow is very scanty. There is no menstruation at all. 4 months, 6 months, and there is no menstruation. Then, of course, PCOD, the very famous condition nowadays, ultimately leading to difficulty in conception, that is infertility. So, out of 20, 15 patients are complaining of these 5-6 complaints. So, this cyclic pattern is totally lost. That is the situation today. And what is the common cause? And that's why the female who sits in front of me, agar main poochu, what is wrong with you? How can I help you? She says, oh my God, it's a hormonal imbalance. And hormonal imbalance, which is occurring at hypothalamus, please remember, this term is getting generated at the level of hypothalamus. Something is wrong with hypothalamus, not structurally, but functionally. And that's why the book like Harrison also mentions, it's a hypothalamic dysfunction, which leads to disturbance of pulsatile release of GnRH, which normally occurs every 90 minutes. This is not released in the same pattern every 90 minutes. So the main disturbance, the beginning disturbance, the start, the origin is at hypothalamus in the form of GnRH release. But natural, once the GnRH release is disturbed, the FSH released in first half of cycle is disturbed and LH release in latter half of cycle, because pituitary needs signal from the hypothalamus. If that signal is wrong, the release of hormones from pituitary is wrong. Now, if the follicular stimulating hormone is not coming from pituitary, the follicles will not grow. If the follicles don't grow, there will not be any ovulation. If there is no ovulation, there will be no conception, and so is the disturbance in fertility. That's what is happening. From 18 years to 28 years, the girls are brought by mothers to my clinic saying those complaints. And after 28 years, once they get married, the major complaint is unable to conceive. Disturbance in fertility. And of course, in addition, I have mentioned is the reversal of ratio of FSH and LH. These two hormones, like I said, FSH is in first half of cycle and LH is in next half of cycle. Instead, what we observe is the persistent high levels of LH and persistent low levels of FSH. This is again hormonal imbalance, which is responsible for PCOD. And PCOD is not a disease, but it's a lifestyle disorder. Today's lifestyle disorder. It is like hypertension. It is like diabetes. It is like coronary artery disease. It is like acidity. It's a faulty lifestyle which is leading to the change in the cyclic pattern, leading to the manifestations with which the females come to us. So with this background of hormonal imbalance, how can it be corrected by science of yoga? And what comes to our rescue is Ashtanga Yoga. How do I treat such cases in my clinic? Is by giving 3 cycles of hormonal medicines, the estrogen, progesterone pills, advising her to take care of her all basic parameters. And after 3 cycles with medicines, again she comes back to square one. So she is utterly frustrated. Then she changes the doctor. Changing the doctor is not the solution. That doctor is going to give the same combination medicine, but of different companies. So from one doctor to another, next doctor to another, and she really gets frustrated by hearing this term again and again, hormonal imbalance. So what should come to her rescue is an approach of discipline. Ashtanga Yoga D is a discipline. It's a disciplined approach which will definitely help her, predictably help her, if there is nothing wrong with her genital organs and the controlling system as far as the structure is concerned. Because as I already said, it's a dysfunction. Nothing is wrong in the brain. Nothing is wrong with hypothalamus. Nothing is wrong with pituitary. Nothing is wrong with ovaries and uterine endometrium. It is the cascade. It is the cyclic pattern. So we all know, being yoga professionals, Ashtanga Yoga deals with 8 limbs: Yama, Niyama, Asana, Pranayam, Pratyahara, Dharana, Dhyana and Samadhi. And we know Yama offers us the social discipline, Niyama, personal discipline, Asana trains and tunes are for our body discipline, Pranayam is our energy discipline, Pratyahara is mind discipline, mind your mind. And Dharana Dhyana help to develop the rationality. Pratyahara helps to control our emotions. And the whole Ashtanga Yoga approach, the disciplined approach, in a way help to have a balance between our emotions and rationality. They deeply root a habit of analyzing the situation, judging our own emotions, and keeping a balance. As we can say, the yogic tree, we started with Yama and Niyama, are the roots. And if at all we want to water the plant, we'll water the plant, not spray the plant, but water the plant to Yama and Niyamas. That is the roots of the tree. So out of all 7 or 8 limbs, why I am saying 7? Because Samadhi is not my cup of tea. Out of all 8 limbs, which limbs are most important is Yama and Niyama, and nobody seems to be talking about it. Everybody talks about Asana, Pranayam and Dhyana. These 3 have become very famous. But let us remember, whenever we want to help somebody, we have to talk the term of Ashtanga Yoga and not only Yoga. So behavioral discipline forms the main part. So 5 yamas and 5 niyamas are to be followed as far as possible. Then only we are going to get the results. Following only asana, only pranayam, only dharana probably may not give results. So we have to talk about yamas and niyamas and try to follow them. And as we know, 5 yamas and 5 niyamas are helping us like 4 pillars. They constantly remind us about our behavioral discipline. Ahimsa, Satya, Asteya, Brahmacharya, Parigraha. Shaucha, Santosha, Tapaswadhyaya, Ishvara, Pranidhan. So these 5 yamas and 5 niyamas should be remembered moment to moment to keep our behavior in a disciplined pattern. Optimum sleep, rest. Optimum ambition. One should be ambitious. Today is the International Women's Day. We all should be ambitious, but that ambition should be optimum, which should not trouble us, which should make our life worth living and enjoyable. And of course, the willpower for our food habits. Many times we do understand, but we cannot do it accordingly. So we have to increase our willpower to stick to our healthy food habits. So that reminds us of the Bhagavad Gita shlok, Yuktahara viharasya yukta cheshtasya karmasu, yukta swapna vabodhasya yogo bhavati dukkhaha. So all this behavioral discipline we have to follow. Then of course comes asana. We are all interested in doing asanas. We are rather addicted to doing asanas. The prone postures, the supine postures, the standing postures, which take care of our body, makes our body very agile, very supple, especially the spine, the vertebral column, all the joints in the vertebral column, and of course the shoulder girdle and the pelvic girdle. We have to mobilize it and keep it very flexible with good strength in the muscles. Very sufficient strength in the muscles is very, very important, and we have to pay attention to it. What is the distribution of fat and muscle? How much muscle mass we have? How much fat mass we have? We have to pay the attention by practicing asanas. The standing postures, of course, taking rest in the end, and coming to therapeutic postures. Here you can see the therapeutic postures, which is a design of Iyengar Guruji. The Viparit Dandasana bench is a gift of Iyengar Guruji to mankind. The arrangement of bolster and pillow and blanket to enjoy Supta Virasana, Supta Baddha Konasana is like treat. If you ask me, madam, what is the treat for you? I say Viparita Dandasana on bench. It is like a treat. It's like a feast. You feel too great. You feel too happy. So these are the therapeutic postures because they help your body, they support your body to bring about changes in your body, and mainly the breathing. The breathing changes immediately the moment you are doing these postures. It becomes deep. There is enhancement of ribcage expansion passively without you understanding it. So we have to remember these therapeutic postures. We have to practice them every day to work on your mind. It is not only working on our body, but working on mind. These three postures work on our mind. They bring us Samatvam. They control our emotions and they control our thought process also. And of course, next is Pranayam. But before Pranayam, we have to understand how do we breathe. So basic education for breathing is very essential for all of us. Like the upper image is showing, she's keeping her hands on her lower part of the rib cage where she is practicing bucket handle breathing. The second image, she's keeping a fist on her sternum where she is practicing pump handle breathing. And the third, she's keeping her both hands on the clavicle and upper 1/3 part where she is breathing in a clavicular pattern. So we have to understand, learn the technique of breathing, and we have to work on our rib cage so as to work on our mind. Because we all know breath is a bridge between body and mind. Proper deep breathing brings samatva state of chitta. So every day, at the end of the study, or whenever we are having time and our stomach is empty, we have to work on our breathing without fail. Then only we will reach our subconscious mind. By working on breathing, we are reaching our subconscious mind, and you know the boss of subconscious mind is hypothalamus. So if we want to reach our own hypothalamus, we have to work on our breathing. If at all we want to work on our hormonal balance, we have to work on our breathing. That is a pathway. Now this girl is doing abdominal breathing by keeping her hand on the umbilical region, on the abdominal wall. And you all know abdominal wall going up during inhalation and going down during exhalation. So we can breathe by either abdominal way or thoracic way. This is the thoracic breathing, breathing by rib cage. And this is abdominal breathing, breathing by diaphragm, thoracic diaphragm, which contracts and goes down, and hence the abdominal wall pops up. So this is called diaphragmatic breathing, and this is called intercostal breathing, because thoracic breathing is occurring because of intercostal muscles and many other muscles which are attached to rib cage. So we have to have this basic knowledge of rib cage as well as diaphragm so that we can work on it consciously. Conscious efforts requires knowledge. Without knowledge, how can we work consciously? And yoga is nothing but conscious efforts. It's a conscious discipline. Whatever is occurring at subconscious level is automatic behavior. But we want to modify our behavior. We want to evolve ourselves by our own conscious efforts. So this is about abdominal breathing. Then coming to next limb, that is Pratyahara. And what is this image showing? Image is showing different inputs: eyes, ears, tongue, skin, and nose. These are the sensory inputs which are entering our brain. And whether we wish it or not, every sensory information is going to give rise to emotions or thoughts. You see something, you feel happy. You see something, you feel unhappy. You hear something, you feel happy. You hear something, you feel unhappy. And this pendular movement of happiness and unhappiness really troubles us. That it troubles the hypothalamus. And that's why the state of equilibrium. That's why the state of Samatvam. That's why let us control our sensory inputs. Minimize them, optimize them. Because once they enter the brain, they are going to have some effect. So we can just put a board of no entry. No entry is Pratyahara. No entry to sensory inputs. No entry means optimizing. It is not totally closing the doors, but it is optimizing. Because then only we will be emotionally stable, and in the thought process we'll be having concentration, emotional stability, and observation of thought process. That's what we should develop the habit. Constant observation, constant awareness of our own emotions and our own thought process is Pratyahara. And Pratyahara is well studied in the state of Shavasana. We all know Shavasana is a very difficult, challenging asana where our whole body is relaxed. We try to relax the whole body in the form of all muscles, skeletal muscles, but keeping our mind alert. Mind alert is subconscious level. We have to learn to approach our own subconscious mind. Can we reach our subconscious mind? Yes, we can. So consciously, we have to attend our subconscious mind. See the beauty. For that, we have to use our conscious efforts. It will not happen automatically. We have to develop the habit. And that's why the first word says conscious relaxation. We have to learn to relax. We have to practice to relax. Today in my lecture, in the morning itself, I said that stress response is a natural response. It automatically occurs in our body without we knowing it. But relaxation response is not automatically happening in our body. It is not a built-in response. We have to learn it. We have to practice it. We have to remember it. Learn to relax. It is easy to say, oh, come on, relax. It is not like switching on the button. So conscious relaxation is practiced in Shavasana. And then comes auto-suggestion, visualization, and Sankalpa Nishchiti. Sankalpa is resolution. So what is this auto-suggestion? We can give suggestions to our own mind that is working at subconscious level. I don't want to be angry. I don't want to be jealous. I want to remove this habit of comparison. I want to conquer my compulsive buying. I have to conquer my compulsive talking, meeting to so many people. So whatever is troubling me, I have to learn to minimize it. And these auto-suggestions should be given so that the hypothalamus will not be troubled every now and then. Auto-suggestions. There is visualization. We are having a beautiful capacity to visualize. Now this is a picture of probably Amsterdam, showing tulip garden. So we can imagine that I am in Amsterdam and I'm seeing the tulip gardens. Why not? We can be in Kashmir within no time. I can be in Boston with my younger son within no time. So power of visualization, power of positive emotional impact, that power we can develop. We can remove the troublesome thought and replace a good, positive, nourishing thought in our mind, which will help hypothalamus. Let us use that power. If we are not getting sleep, I always tell that, think about your study. The moment you think about your study, you will immediately sleep. So nowadays, last 8 to 15 days, I'm studying vagus nerve. So whenever I find difficulty in sleeping, I try to recollect whatever I have learned about vagus nerve. What are the nuclei? What is the pathways? Within 5 minutes, I sleep because the brain says, enough of this recollection, don't trouble me, I will better sleep. So there are many tricks which we can use. We can use many tricks of auto-suggestions. We can use many tricks of visualization to keep our hypothalamus in a stable condition and it will function properly. And of course, coming to Dharana and Dhyan, Dharana is called concentration meditation. Desha Bandha Chittasya Dharana. We have to concentrate on any one object. It may not be object, it can be action like simple cooking. Any action, any activity which is of your passion. And you are doing Dharana. In practicing yogic postures, we are doing Dharana. I am practicing Tadasana. My mind is in Tadasana. My mind is in my body parts. My mind is in joints and muscles. I am doing Dharana. So Asana practice involves Pranayam also and Dharana also. And I tend to forget anything what is happening all around me. It's a state of Dhyana. So if we really practice yogic postures with all our attention consciously and not subconsciously, we are using our conscious brain by doing concentration and then experiencing that state. So by abiding all these 7 limbs of Ashtanga Yoga, we are helping our body. We are helping our hypothalamus to maintain homeostasis. So in the end, it is the balance of emotions and thoughts. The constant thought process and thoughts giving rise to emotions and emotions giving rise to thoughts, which is disturbing the hypothalamic hormonal status of our body, can be controlled, can be reversed, can be brought to normalcy. Now, supposingly I see a case of fibroids. Fibroids is because of high estrogen levels probably. I see a case of excessive menstrual bleeding in my clinic. Nowadays, I have started, for last 5-10 years, I have started asking her the question, okay, this is excessive bleeding for how many days, how many months? Let me see the sonography ultrasound report. What does it show? Whether it is having fibroids or whatever. All those technical matters we are talking with the patient, that is fine. But at the end, I ask her, is there any problem at your family end? Is there any problem with your family or your career or your job or your work? Then for a moment, she remains silent. And then for 5-10 minutes, she talks and talks and talks. And I could hear a lot of problems in her life. lot of turmoil in her life, which is probably not seen in that ultrasound report, which is disturbing her mind, which is disturbing her hypothalamus. The GnRH, the pulsatile release is totally disturbed. Too much of FSH for a long time, too much of estrogen for a long time. Uterine endometrium is increasing, so she's bleeding a lot. Probably she's developing fibroids. This can happen. So there is a mind part to all and many conditions, which is neglected many times. So every female has to develop the habit of course, the situation which is disturbing, the situation which is challenging will be there. But it depends on how we deal with it. Everybody has problems, but let us learn the art of dealing with it with minimum impact on our body, mainly the hypothalamus. As far as the hormones are concerned, it is the hypothalamus. So let us observe, we become aware of our emotions and thought process. Ultimately, if we teach these girls or these women to follow a yoga protocol, maybe for 1 month, 2 months, or 3 months, what we are observing in our clinic and our yoga center, which is adjacent to my clinic, her menstruation starts coming without any medication. And she feels so happy that in a running speed, in a jet speed, she comes to my clinic just to say, hello, doctor, I got my periods without medicines. As if it is a great news. It was to come. It has to come. Now I'm practicing for 40 years. First 30 years, I never had these kind of complaints. Almost all females used to get monthly cycle, menstrual cycle. That used to be very common. Now, like normal vaginal delivery has become uncommon, the normal menstruation has become uncommon. And it's all because of our mind, thought process, and the lifestyle. So, if she learns to manage her emotions and thought process and disciplines her behavior, disciplines her body, cyclic menstruation is bound to happen. Freedom from PCOD is bound to happen. She's going to become mother within 3 to 6 months and happy motherhood as well. Because there was nothing probably wrong with her after we rule out the basic disorders. And that is what I wanted to share with you. Thank you all for patiently listening to this probably bombarding talk. So that is what we offer at Gnosis Medical Yoga, saying beyond medicines. The body functions should be understood beyond medicines. Thank you, Shivani. And thank you all.
थँक्यू मॅडम. खूप खूप छान झालं तुमचं. आणि मला तर फार म्हणजे रिव्हिजन इतकी झाली. तुम्ही तर म्हणताय की बोरिंग असेल. नाही, उलट अजून 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 ऐकावंसं वाटतं.
थँक्यू रंजना. थँक्यू सो मच. थँक्यू.
You can end the share screen option. And yes, we are open for the question answer session. So if anyone has any questions, please feel free to ask.
एक मिनिट विचारू का? एक प्रश्न विचारा. जर एखादं पर्सन, त्याला सगळं माहितीये, पण मी म्हणजे एकदम छानच आहे, माझं काही चुकतच नाही, बरोबर आहे, आणि त्या ह्याच्याने डील करतं आणि मग त्याला ते प्रॉब्लेम होतात, म्हणजे जास्त रक्तस्राव होणं किंवा डोकं जास्त दुखणं, डोळ्याभोवती काळं होणं. बर, रेग्युलर एक्सरसाइज चालू आहे, सगळं चालू आहे, मग ह्याच्यामध्ये आपण काय करू शकतो?
ह्याच्यामध्ये आपण त्यांना परत परत समजावून सांगायला हवं आणि शवासनाचाच उपयोग, शवासन आणि डीप ब्रीदिंगचाच उपयोग जास्तीत जास्त करायला हवा.
My request to translate this question in English so that everybody can understand the answer.
She is saying that if somebody is very adamant, feeling that I am the perfect person, I am doing everything for my behavior, I am taking care of my health, but still something is wrong with me, like supposingly migrainous headache or insomnia, or persistent health problems which cannot be dealt with medicines. It's because of the personality problems. How can we help? That's what Ranjana is asking. It is a stubborn personality, not accepting the weaknesses. On top of it, saying that I am the perfect person. So reaching their subconscious mind is very difficult, very challenging, Ranjana. But still, you have to have a lot of patience. And for them, you have to take daily 10-minute Shavasana in a way of counseling indirectly and work on their breathing. All the postures where deep breathing is occurring automatically, that will definitely help them to introspect their behavior. Just don't tell them their faults. You just tell them that you observe your behavior. Just make them aware of their own awareness. Probably that may help. Right, Ranjana?
Thank you.
Okay. Okay.
Any other questions from the audience?
Ma'am, is it normally just PCOD where there will be problems with period, or there can be any other things as well that are there?
The menstrual problems or menstrual irregularities is a very, very common. Like I said, the cycles not coming at all, menstruation cycles not coming at all. Either excessive flow or very scanty flow. Both ways the complaints are very common. So if the estrogen levels are high because of high levels of FSH, then she will bleed a lot. And if the estrogen levels are low, she will have scanty flow. So it depends on what is the imbalance at what level, whether it is high FSH or it is high LH. It all depends. And that is disturbed because of GnRH. So ultimately what is wrong is the hypothalamic dysfunction. But both ways they can complain. Yes. So I think everybody is happy and silent. I think they are all meditating.
So let's conclude the session.
Yes, conclude the sessions. Let us say 3 times Omkar. I will say 3 times Omkar so as to bring equanimity in my mind. 3 times Omkar. Deep inhalation followed by prolonged exhalation. Omkar during exhalation. First Omkar Akar Dirgha, that is prolonged. Second Omkar Ukar prolonged. And third Makar prolonged. Slowly open your eyes. Are you? Thank you, Shivani.